everyone.
Oh,
Apologies for late start. We had a few technical problems because it's Monday and that's how Mondays go. But we're ready to go now. So thank you all for coming to this webinar on our active monitoring campaign and our new checklist. For anyone who doesn't know me, I'm Beth. I'm the support nurse here at WMUK. And joining us this evening is Charlotte Bloodworth. She's the lead haematology CNS for West Wales. And as well as having huge experience looking after patients on active monitoring, she also plays a lead role in developing our active monitoring checklist. So we're really lucky to have her here this evening. Before I bring Charlotte in, just a little bit of housekeeping. If everyone could make sure they're on mute. So if you just click the microphone icon at the bottom of your screen, there should be a red if you're on mute. That'll be lovely. And also just to let you know, we're recording the webinar so we can upload it on our website so everyone can watch it afterwards. And there'll be plenty of time for you to ask Charlotte questions after she's done her talk. So have a think of what questions you want to ask, but you can also write your questions in the chat and I can read them out for you if you prefer. So yeah, over to Charlotte.
well, thank you very much, Beth. And I apologise to everybody. It was my fault that we're running late because I just couldn't get my computer to get sound on. So I'm on my phone. So please definitely bear with us. But I have asked Beth and Alison just to put up some bits of the website because I was really going to go through the website and talk a little bit about the project that WMUK have been running, which has culminated in the active monitoring checklist, which I just wanted to go through as well. So feel free. I can't see anybody on my mobile phone, but if anybody has a question, just raise your hand or let Beth know because I can see Beth and that's it. But yeah, so I'm Charlotte Bloodworth. So I have had experience with these evening talks before where my computer's actually worked. So I know it does work if I'm on a good computer. I don't know what's happened today. Anyway, so as Beth said, I've got lots of experience in looking after people with lymphoma. So I've been a nurse now for 29 years, which I can't believe. 21 of them which have been in haematology. And I have just left Cardiff, where I was the advanced nurse practitioner for lymphoma, and just moved a little bit further west now. And I'm the sort of lead haematology nurse for Hull Dar. So I'm still very much involved in lymphomas across the board, but now I'm also looking after a few other haematology diagnoses, which also involve active monitoring. So I'm still learning. So I think I got involved in the active monitoring project because I was interested in this period of active monitoring, the period where people aren't on treatment, because it can be a really anxious time. I think there's a lot of worry, a lot of questions, and very little time actually with healthcare professionals. So it's definitely an area that as a nurse, we really wanted to look into and improve. And we were really lucky at the time to sort of jump on the WMUK bandwagon because they were also thinking along the same things. I think they were getting a lot of feedback from people asking questions or noting that really there was a lot of differences across the nation about how people were treated, different experiences. So some places, got very close monitoring, others only got seen sort of once or twice a year. And there was a lot of uneven practice going on. So WMUK made it one of their priorities this year to really, or the end of last year as well, to investigate what's going on. So they started doing some audits. I don't know if anybody was involved in that. getting a bit of experience from listening to the experiences people were going through, and getting a little bit of evidence about what is actually happening out there. So what they did with all this information was put together a project team. So I'm part of the project team. In the end, there were 200 patients and 50 healthcare professionals that were part of this project team. And they were part of a scheme where we did sort of a Delphi research technique. And from this, we discovered sort of areas or gaps in practice. You know, some people didn't get a lot of information at the start, others people did. Really, it was sort of asking everybody what they thought was best practice. And what we got out of that was an actual sort of research project, which hopefully is going to be published soon. From the research project, what was developed was the active monitoring checklist as one part of the project, which I'll talk about in a second. But as part of all sort of that evidence gathering, WMUK also have produced some information videos about active monitoring. And I was going to hopefully, we've got the screen for WMUK website up. Hopefully everybody has had a look at this. So I wasn't actually going to talk about what active monitoring is, really, because it's all on the website. So if we can just flick through the website just a little bit, there's some information on about what active monitoring is. So active monitoring is actually quite a new term. In the past, we used to call it sort of watch and wait, but then people started calling it watch and worry because it really was a time where people were worrying about what was going to happen. So watch and wait definitely was a term that needed changing. And over the years, we've sort of used different terms. Surveillance was sort of the popular one, but now it's very much the term for the modern term is active monitoring. And that's really because this should be a period that is active, and it should be active for us as healthcare professionals, but it's also active for patients as well, or people with WMUK. As healthcare professionals, there are a few things that we should be doing during this period, which I'm going to come to. And then there are a few things that people can do themselves on this period as well. And even though we all know like little bits of what we should be doing, really, this whole project by WMUK is what has brought it all together, and hopefully has now provided us a framework of what people could be doing, what health professionals should be doing. So the checklist, which I'll just go into, lovely, is also on the web pages, which is nicely put up there for us. So from our sort of Delphi research project, from all the evidence that was gathered, the result was this lovely, very easy to use checklist. And it's really sort of a guide to what healthcare professionals should be doing during an active monitoring consultation. And it was launched this year at the National British Hematology Society conference. So I just wanted to run through the checklist. It makes everything just a little bit more clear, so brings a little bit of clarity. So ideally, we took a little while deciding where the checklist should be placed. Should it be that consultant that right at the start on giving diagnosis, should they be giving it out? or is it best placed with the nurse that discusses all the diagnosis and discusses the consequences? Or should it be best placed with people with WM? You know, should you be taking it into your consultation? So I think this is still something that's ongoing, but I would say as a specialist nurse, I really do feel it is placed with the specialist nurse, because the specialist nurse really is the bit that ties everything up together. So I think as part of the initial new patient consultation with your CNS, that this checklist should be brought out and discussed. So just going through it, what it consists of. So I do want to ask anybody if they've come across it, and I'll give my sort of experience of using it. So basically, the first part is what will active monitoring consist of. So this really is the bit that sort of says, you know, what actually is it? When are my appointments going to be? How often are they going to be? What do I need during my appointments? So that bit really is quite straightforward, and I'd say hopefully everybody gets that bit. But it's quite nice, really, to have a little bit more clarity to it. So sometimes you might leave your consultation and not really know when you're going to be seen again, or you might see one doctor and they say, well, let's see you in 6 months, and you might see another one and say, well, we don't need to see you for a year. So it just brings a little bit of sort of clarity to the situation. The next bit is about WM itself. So, you know, have symptoms been discussed? Is there anything that you need to know, any new symptoms to look out for? You know, do you understand about WM and your immune system? What precautions do you need to take? Have you had enough information? So it's really just delving a little bit more deeper into Waldenstrom's itself. I think in practice, people with WM are looked after in lymphoma clinics in some places, but myeloma clinics in others. So sometimes it's nice really just to bring the focus back in on Waldenstrom's rather than on sort of lymphoma or myeloma in general. So it's quite nice to go through and just see whether you know, specific symptoms have been discussed. So the next page now discusses about additional support during active monitoring. So for me, very important that you know your contact details of your clinical nurse specialist. You know, in all the sort of studies on anxiety and well-being, having a clinical nurse specialist is really important. And the clinical nurse specialist is there as a sort of a point of contact, but also somebody that is there to listen, to understand what's going on, and really to reassure and really spend some time really to say whether your symptoms are due to WM, or are they just due to aging, or due to something else. The CNS is the sort of most accessible person. Well, I think we're most accessible. So really, this part on additional support is making sure that you definitely know who your clinical nurse specialist is. Again, a lot of these clinics, if you're not on treatment, you may not come across a CNS at all. So it's just making sure that you know who your CNS is, because you will have one, and making sure you've got contact details for them, even if you don't see them that often. And then there are just a few other things about making sure you have information about support groups. WMUK, definitely. The other blood cancer support groups are really good, but don't go into so much detail about WM in particular. So I think, you know, as well as knowing about the other support groups, you definitely need to know about WMUK, and hopefully you will if you're looking at this active monitoring checklist, or your CNS will make sure you do know about it. And then there was a section about contributing to WM research. So that goes on to sort of flag the Rory Morrison registry. So that's a registry that's collecting all the details about WM across the nation. So, you know, WM really is a really rare type of lymphoma. So the more information that we can gather about it, the more we'll learn and the more we'll be able to improve practice for WM. So this Rory Morrison registry is core at that. So it's a voluntary thing. So not all hospitals offer it, but they should, in a way, help improve practice. So really flagging it to those hospitals that haven't got it is a really good thing, or I think it's a very good thing. So I'm glad that's part of this checklist. And then there's a section about lifestyle. So again, you know, this is much more than just, you know, your WM markers, physical things. It goes into sort of a little bit more holistically. So it looks at you know, impact on your general well-being, just gives you a chance to stop and talk about things. And this section really, to me, is the bit that should empower you to make this sort of phase of active monitoring active. You know, have you discussed the importance of regular exercise? The importance of having things like immunizations, things like that. So it's very important to include that section really on an active monitoring checklist. So that's the active monitoring checklist in a nutshell. I'd be very interested to see if anybody's actually taken it to their consultation or whether it's been brought out in a consultation. It is relatively new. Like I say, the British Society of Haematology conference was only in April. So this is where it was launched, really. So it was only, you know, only a couple months old. And I think in practice, I've desperately been trying to get it into consultations. I definitely think it's best placed for new diagnosis. It might not be needed to be brought out every single consultation that you have, but I think it is a good guide as well as a learning tool, and that's the other part of this whole WMUK project, and that's really to help improve healthcare professionals' practice. So, you know, there's definitely a lot of variety out there with healthcare professionals in the way that they run their consultations. Some do telephone consultations, some do face-to-face, some do like a patient-triggered consultation. So it's really nice to have a bit of a backbone, a bit of structure around the monitoring of WM. So this checklist for me is a great learning tool for specialist nurses as well as doctors. So again, we are trying to provide that as part of the project. And there is a section, I know Alison and Beth have been working with a filming team, and as part of that, they're doing some sort of films to guide people that do want a bit more information about WM consultations. And in that sort of, especially like the nurse part, you can do a bit of reflection on the consultation. And I think, thank you, someone who's moved the screen for me because I can't on my mobile phone. But some of these videos are up on the website and they really are worth watching. There's a couple of videos about patient experience, and they're nice and short, only sort of less than 10 minutes or 10 minutes long. And that there's sort of really powerful videos for I'd say me as a healthcare professional, just to really hear from people about what happens during active monitoring. or sorry, the feelings and things like that that are going on, all that turmoil that goes on during active monitoring. So that's a really, really worthwhile video. There's then a longer video that helps guide healthcare professionals as to right from diagnosis. There's a couple of actors there, so you get a bit of sort of insight about what people are feeling like after the discussion, midway through the discussion. And it's really aimed at sort of improving practice and bringing a bit more of a standard approach, which I'd say all this sort of project work over the last sort of 6 months, year, are hoping to do. So it really is great work by WMUK, and hopefully soon it'll be audited to see whether it's actually had any impact on practice. So I think there is a difference between active monitoring for people with WM and active monitoring for people who have other cancers or other types of lymphoma. I think there are a few more details in WM that you really need to include in these sort of active monitoring consultations. So hopefully that was a bit of an insight into all the different bits of the project that we've been working on, and a bit of an insight into the checklist, which is sort of the working part of the project, or the sort of product of the project. But I don't know if we want to sort of open up to the floor, or Beth now. I don't know if you want to ask any questions.
Thank you so much, Charlotte, by the way, that was fantastic. If anyone wants to ask Charlotte any questions, then press the raise hand icon at the bottom of your Zoom screen and I can call you in. Or again, you can write the questions in the chat if you're feeling a bit shy and you don't like public speaking. Or if you want to share your experiences of using the checklist, or share your experiences of active monitoring in general, and I'm sure we've got lots of newly diagnosed people here, so I know they find it really reassuring to hear from some old hands about their experiences. So please do ask your questions. I'm going to be a bit cheeky and use my host privilege and ask Charlotte my own question to start with. So I found when I was a CNS, lots of patients asked what symptoms are they supposed to be looking out for when they're on active monitoring. What are they supposed to be ringing you about? That's what most people are quite anxious about, they found. What would your advice be to those people?
Yeah, so I suppose so it definitely needs to be individualized, because Waldenstrom's is very unique in that you do have symptoms, exactly the same symptoms, and not everybody has those typical sort of lymphoma symptoms, even though it is a type of lymphoma. If you look up symptoms for lymphoma, you'll get swollen glands, that type of thing, and that's not necessarily correct for WM. So some people might have a few swollen glands, but really it's more sort of bone marrow infiltration. So I'd probably say the red flag symptoms typically are anemia, because that shows that your bone marrow is filling up with cells, because you're not producing sort of a good amount of blood cells. So and the symptoms of anemia are breathlessness, especially when you're active, because you just can't get that oxygen around your body. You're very pale, and you can be fatigued. So fatigue is quite a difficult symptom. So I don't always say fatigue is a red flag unless it's related to anemia. And then, of course, with Waldenstrom's, you have sort of viscosity problems. So, you might have headaches or bleeding from your gums or back passage or something like that. So I think it very much depends on the person that's in front of you. You have to tailor it a little bit. But I'd say weight loss as well. So weight loss, breathlessness, and any sort of viscosity symptoms are those sort of red flags to us that we want people to be contacting us about. But I'd probably say, if there's any concerns, it's always good to ask. I think if you get in contact with your CNS, I'd say we can always say, oh no, that won't be anything related to WM. Or we could say, oh no, hang on, I know your immune system is very weak. You've had repeated chemos. Having constant infections, might be a sign that your WM is playing up a little bit. Come in and we'll have a check. I think flat raising them or advice is the most important thing there.
Thank you, Charlotte. That's great. Gordon in the chat is asking, does the active monitoring checklist relate to monitoring post-chemo or treatment?
Yes, absolutely. So I'd say that active monitoring checklist is basically a time for any consultation when you're not on treatment. So really, I would say looking at it, initially, I thought it was only going to be important on sort of new diagnosis to help sort of explain, what active monitoring is, what you should be looking out for. But really, I think that people that aren't on treatment, don't get seen as regularly as if you were on treatment. So it is worth bringing up that checklist again. So I would consider it as, unless you're on treatment, really you should be following that checklist.
Lovely, thank you. Andrea as well has said active monitoring brings a feeling of abandonment. I think a lot of people can feel the same. You kind of touched on it with what you've said previously, that your CNS and your team are always there for contacting, but that you can be seen a bit less than if you were on treatment by your team. What else would you say to?
Yeah, so I'd probably say, so I've been a CNS for an awful long time, and when I first started, there were very few CNSs around, and you literally were firefighting. So you went to where you had to, which was when people that were on treatment, because you had to get their treatments booked in, you had to sort after look after side effects. Everybody else that wasn't on treatment were definitely not seen as often. I would say initially for my first few years, I never saw anybody that was on active monitoring. The cancer plan came out and said that everyone that had cancer had a named CNS, and all of a sudden it was well, hang on now, I've got hundreds of people in clinics that have never seen my face, let alone heard my name. So I think now that time has moved on and we've learned more, really, I'd say thank you to WMUK as well. Really, we've got more feedback to say that the active monitoring stage actually is a stage where people do still need help, still need input. That sort of feeling of abandonment is definitely there as a possibility. I think you need to get out there and sort of signpost to where the information, where there is support. You might not necessarily be able to see a consultant as often as you want to see them, but you really probably don't need to. There's loads of information on WMUK. You can get a buddy. There is a lot of support out there, and I think if you know what you need to do, which is this active bit, if you know you need to look after yourself physically, if you know you need to look after yourself mentally, you can sort of set goals and look at it as more positive things. It's very much there's a sort of a term called sort of prehabilitation at the moment, which is very fashionable, and that's really about getting yourself fit and well before treatment. And to me, that's what active monitoring is. So you may not, as WM, you may not need treatment for years and years or a decade or so, but you more than likely will probably need treatment at some point. So you should see this time as an opportunity to be able to get your body fit, or to keep it fit, just in case you do need treatment. And I would say, especially heart health, we're getting a lot of new treatments on, rather than sort of chemotherapy, with a lot of targeted treatments. But you do need sort of a good, healthy body to be able to tolerate them. So, this active monitoring thing really should be positive, as well as a time to sort of learn a lot more as well. I don't know if that was a good answer there, Beth.
Oh, great. Maureen's got her hand up to ask a question. Do you want to come in, Maureen?
Yes, please. The hospital and consultant that I am actually registered with, I know nothing about this. I've seen the consultant about 3 times. I have bloods done on a regular basis, and then I have a phone consultation, and that's it. I don't know a CNS. I know nothing. So
yeah, so that's a shame, really. And I'd say probably that's one of that is exactly why WMUK have come in and sort of worked on this to improve that sort of practice. I think I would say more than likely there will be a CNS there that is for you. Really, you should know the name.
no.
It's very difficult for me to comment on other areas, but I would say if you phoned up the consultant secretary and asked to speak to your CNS, I bet they would know straight away who it was, and it would probably be worth it, just to say, I haven't met you, I have a few questions. Is it possible to meet you, or talk to you? And hopefully you'll get a positive feedback from that. I think. Again, sorry, you carry on.
I was just going to say that they still call it watch and wait.
Yeah. Again, active monitoring is a modern term, so probably only been around for the last properly for the last year or so. I think it's really been driven by the sort of cancer charities, and the sort of prehabilitation, pre-surgery sort of movement in the NHS. So it is relatively new, and I think the trouble is if you're not seen regularly, if you are very stable, in their heads they're not worrying about you at all. They think you're absolutely fine, whereas we know there's a lot more to it. And I think really, again, WMUK are sort of raising this, so hopefully things will change in the future, and you won't ever not know your CNS, or not know who to go to.
Right. It's just that you mentioned viscosity, and when I have bloods taken, I don't bleed at all. And I am noticing it different when it's warm now. I find it a bit hard to cope with, which never bothered me before. So, this would be nice to actually speak with somebody at length.
Yeah,
I
definitely.
haven't got that luxury at the moment.
Yeah, well, I would say give those medical secretaries a ring and ask. And when you do get an opportunity to speak to your CNS, show them that checklist, or bring the checklist, with you to the consultation. I think it would be really worth it. I think, this is what the checklist has been made for. Right.
Okay. Thank you. Well, sorry about that. I don't wish to hog the floor, but will my hospital actually be included? Is this going to be rolled out for everybody? And because it feels like we're in the dark ages at the moment, and where I am. So
yeah, so I think WMUK are trying to get around as many hospitals as possible, and putting on education for CNSs. So it's not something that's going to get sent to every hospital, but hopefully the information will be flooded out, so that there's a very rare person that won't have heard about the WMUK checklist. but that sort of takes a bit of time. It was only launched in April, so to get to the quieter hospitals will take a little bit longer. So so definitely you take it to them first.
I will, thank you.
Thanks, Maureen. That seems like a good time to bring Alison in, because that's what she's been doing, is speaking to health professionals. So Alison, do you want to come in?
Yeah, sorry. I know that there's a few questions in the chat, so I don't want to take up too much time. But my name's Alison. I think I've met the majority of people, but I'm the Chief Nursing Officer here at WMUK. Charlotte, thank you so much. It's been a really great session to go through it. Maureen, just to sort of touch on a bit about what you were asking in terms of your CNS. I just want to make nod to the fact that it varies throughout the UK. So I know in Scotland, people don't get assigned a CNS, which is something that we're going to explore a bit further, and we're going to reflect in the wording slightly on the active monitoring checklist. But everybody within England and I believe Wales, please correct me if I'm wrong, Charlotte, when you're diagnosed with a cancer, you should be assigned a key worker. Now, the key worker is normally a clinical nurse specialist, but it can be somebody else. So like Charlotte said, absolutely reach out to your consultants or your the sort of reception team and just ask them if they can find out who your contact is, because it should be on your patient information within the hospital. In terms of the checklist and getting it around different centres, so that's what part of my role focuses on at the moment is, as Charlotte's mentioned, is trying to raise the awareness and education within healthcare settings about not only WM, but the needs of the patients. And as Charlotte's alluded to, we recognise that there's a real psychological burden that comes alongside active monitoring, and that patients are often really quite left out when, you know, being provided care. So what we want to do is we really want to embed this checklist within healthcare settings. And it's really hard because the NHS is a really large organisation, and from working in the NHS myself, it's really hard to influence change because everyone's a bit scared of change. So it's really difficult, but we're trying to attack it from two ways. So we really want to arm as many patients with it as possible, so that patients can start, you know, advocating for their own care. They can take it into the appointments with them and say, look, you know, I've got this checklist. I would really like you to go through this information with me so that I've got as much information as possible. And then we're also trying to embed it from the nurses down. And that's where at the moment, I'm travelling around lots of different centres within the UK for many different reasons. But one of them is to raise awareness of not only the active monitoring checklist, but other forms of WM literature to make sure that patients receive WM specific information at the point of diagnosis. And that also we can try and get this checklist embedded within healthcare and nurses using it. Because like Charlotte said, there's a bit of a lack of education and knowledge within healthcare settings about WM, active monitoring, the terminology to use. So we really want to not only empower patients to use it, but also empower healthcare professionals to use it. So we're trying to attack it from both ways. I know that there's a few questions in here that I hope you don't mind if I just answer here, Beth. Is it about where to get the active monitoring checklist from? So you can get it from our website. When you go into our main website, there's some buttons at the bottom or at the top that says active monitoring. You can click on there and it'll take you to the active monitoring section of our website. And there's a little button that says checklist. If you click that, it'll bring the checklist right up and you can print it off. If anybody would like a hard copy sent to them, I can absolutely get that organised for you. So please do just drop me an email at info@wmuk.org.uk. I'll pop that in the chat for you. Please do just drop me an email and we can get some sent out to you. Thank you.
Patrick in the chat has also said that he thought the checklist would contain a list of key blood tests and key symptoms as an aid memoir. And at the time between consultations can be 6 months, and the pressure in the consultation makes it more likely to not cover all bases. So Charlotte, how did we sort of decide what to put on the checklist and what to
Yeah, so I'd probably say so there is British Society of Haematology guidance. There's a guideline for WM already there. So clinical practice actually has guidance. So that already will tell you exactly what blood tests are required, what treatments, and sort of what pattern of treatments to use and when. So that's already there. So we're not trying to replicate something that's there. We're just trying to make sure that the consultations involve the bits that aren't on that sort of clinical guideline. And a lot of that is the active monitoring part of it, rather than the sort of treatment blood test part of it. So I think I would say that bit was already covered. So we didn't really want to cross the two over. You know, that the active monitoring enhances the guideline that's out there that is used by all clinicians. Yeah, so that's probably
Lovely. Thank you. That's great. We've still got about 10 minutes left. If anyone's got any more questions or again wants to share their experiences of being on active monitoring.
or share any tips really of, you know, how to cope, especially mentally, with it. I don't know if anybody is sort of taking this active role and taking steps to improve health. You know, is anybody done anything that's worth sharing?
I'd like to share that we're lucky enough in Nottingham to have a Maggie's Centre, and they are absolutely brilliant. I don't know whether, and I know there's quite a few over the country, but they're so helpful. And although they're not WM specific, they do have lots and lots of groups about fatigue or about mental health. I've just done a mindfulness course, which has been amazing. All information about the brain and how it works and how you can overcome stress and anxiety about potential treatment coming up or anything like that. So if you do have a Maggie's, or if you're quite near a Maggie's centre, they are really fantastic. So I would recommend that.
Great.
Oh, thank you.
Yeah, they are amazing. They've got loads of fatigue management workshops and things like that as well, because that's a really common thing that people struggle with during active monitoring, but throughout their WM journey is fatigue, and they've got some great resources for that. Nutrition as well, all sorts. They're excellent. Sorry, Janet, I can see you've got your hand up. Do you want to come in?
The only thing I was going to say is that we all know that when we go to our appointment, the most important, well, not quite the most important, but the blood test you want is the paraprotein test. And quite often you turn up to your appointment, they take all the bloods, and then they say, oh, but we won't get the paraprotein for another week, so we'll give you a ring if there's a problem. Now, I'm lucky enough to be within half an hour's drive of my hospital. So I always arrange to have my bloods done 2 weeks before my appointment. So therefore, I walk into the appointment knowing what the bloods are doing. Now, my luck there is that I'm at the Marsden with their app. So I've got all the bloods results from them before I actually go into my appointment. And I find that helps me cope much more than sitting in the waiting room waiting for them to tell you what your horrible blood tests are. And it makes the whole process much, much better. But I don't know whether other people can organise themselves or have the facility to be able to do so.
I would definitely agree with you, Janet. I think that's a really, really good.
I had to work quite hard to get the Marsden to fit in with me to begin with, because it wasn't their system. But you know, now I do it. I think a few consultants have said, "Oh, that's a good idea." Yeah,
Yeah,
you.
definitely. And again, I'd say, you know, if you have a system really doesn't let you have your information when you need it, again, you know, the CNSs are a really good point of contact. You know, we forever printing out graphs, charts, you know, medical secretaries as well. So, you know, we're definitely there to help give you that information. But I would say it's, if you can find a way of getting it easily, like Janet's, I would definitely recommend to do that. It's a really good idea.
Anne in the chat has said that she finds it difficult to know which symptoms relate to WM and which to other conditions like arthritis, for example, when she has pain.
That's really true. And I'd say probably your doctor has the same problem as well. So a lot of the time it's sort of, you know, matching up what the results on the screen are saying, matching up what you're saying. You know, if all the results are looking absolutely brilliant, it's highly likely that it probably wouldn't be a WM. You know, but I think, you know, that's why it's important to keep in touch really with your hospital team so that you can discuss these type of things. Yeah, it's I think your doctors would be in the same conundrum really. They sort of a lot of things, that's what they spend their time doing, deciding whether it is your WM or whether it is something else as well.
Thanks, Charlotte. Gordon has said, is it then possible to access hospital tests and records? I think it's really variable. So you can't access your hospital records unless you request it really far in advance. But some areas have apps like Janet was talking about where you can access your blood results. But it's quite variable across the country. I don't know if you've got anything else to say to that, Charlotte.
Yeah, no, I absolutely agree. I think England is much better than Wales at the moment. I think on the NHS app you can see quite a few results of your own. In Wales you can't see them at all. But I would say just ask for them. So it's very different than asking for your medical records where you have to go down the official route and ask your GP. You know, if you just say what my last results, you know, someone will print them off for you, or someone will do a graph of you know, the results over time. I just say definitely use your CNS. I think you know, CNSs want to help, and I think I also think if people don't ask, people don't necessarily know. So we might think you're okay, we might think you're not very interested, or we might think you have access. You know, so you need to raise it to us to say, I need to know more. I'd like to see my results.
That's great. Thank you, Charlotte. We've got about 5 minutes left, so we've got time for one more question before we let Charlotte go and home and have her tea. So if anyone's got any last questions or... Oh, so where would we find out more about the registry? So again, it's on our website. I can put a link to the bit on our website about the registry, and you can have a read on our website there. Any last questions? Oh, lovely. So thank you very much, Charlotte, for coming. We really appreciate you giving up your time for us. Have you got any last comments before we let you escape?
No, I'll apologise again that I'm on my mobile phone rather than on my computer. I did have various pages to show you, but thank you, Beth and Alison, for stepping in and showing the pages. Yeah, and no, I just say definitely. I think use the information that you've got to help empower you, and you know, take the information you've got to your healthcare professionals. And I'd say as healthcare professionals, we would welcome it. You know, we welcome questions, we welcome advice on what you want. So don't be scared of getting in contact. You know, we are here for you.
Thanks, Charlotte. That's fantastic. Thank you again for everyone for attending. If after you leave tonight you've got any burning questions, I'm on the support line. Obviously, you can give me a ring or an email anytime. And yeah, we'll put the video of the recording up on the website if you want to watch back. And we'll see you all at the next webinar soon. Thank you very much.
Thank you.
Thank you, Beth.
Thank you.
Thank you, Alison. Bye bye.
Bye. Thank you.